Can you tell who among these people have had a cataract? If you think that one, or perhaps two of them have had it, think again. As a matter of fact, all of them have had a cataract. Cataracts affect millions of Filipinos. While it occurs more often in people over 50, it can affect everyone, young and old alike, regardless of social or economic background. And right now, cataracts are the leading cause of blindness in the Philippines and in many areas all over the world.
A cataract is an opacity in the crystalline lens of the eye. So the lens of the eye is similar to the lens of a camera. So it's normally clear, and if you have a scratch in your camera lens, the pictures won't be as clear. So same thing with the eye. If you have any opacity, any scratch, any little white spot, the vision can become distorted.
The most common symptoms of a cataract include cloudy, smoky, blurred, or dim vision, increasing difficulty with vision at night, sensitivity to light and glare, frequent changes in eyeglass or contact lens prescription, and a fading or yellowing of colors. If you or anyone you know have any of these symptoms, the best thing to do is to go to an eye doctor immediately. Left untreated, cataracts can seriously impair vision and in some cases, even lead to blindness.
Ang sports ko at my age is still yung practical shooting. Very important for us to have a very good eye vision. Napansin ko kasi na lumalabo, so I decided to see an eye doctor.
The best thing to do is to go see an ophthalmologist or an eye doctor for a complete eye exam. And then once it's been determined that you have a cataract, you can talk about what your options are with your doctor. Now, you've heard this term before, na let the cataract mature, or in Tagalog, pahinugin ang katarata. Maybe 20 years ago, 15 years ago, that's something that ophthalmologists used to advise their patients. But nowadays, that's not something that we recommend anymore, because with today's technology, we're able to do this procedure in about 15 to 20 minutes. It's pain-free, no need for injections, no need for suturing. So because of today's technology, with the new forms of equipment and intraocular lenses that we can implant, it's better to remove the cataract earlier than later.
At present, the best way to treat a cataract is by removing it through surgery. And thanks to many advances in technology, cataract removal can now be a quick, easy, pain-free procedure. Once a patient decides to have cataract surgery, they first go through a process called biometry. In biometry, a computer measures the eye so that the eye doctor can determine what kind or power of lens is suitable for the patient. As soon as the right kind of lens for the patient is determined, he or she is then scheduled for surgery.
Okay, once the person arrives here for surgery, they're brought to the operating room. They will be dilated. The dilation procedure is where drops are placed in the eye that will be operated on, and this allows the pupil to dilate to make the cataract visible for surgery. So once that's done, they're going to be changed into an orgown and wheeled into the operating room where the surgery will be done.
Cataract surgery, or any surgery for that matter, is performed in a clean, sterile operating room, ideally one equipped with a laminar flow ventilation system. This ensures the patient's safety and minimizes the possibility of infection.
Papagpapalitan ka ng damit, then you wait for a while, then prepare na nila yung sarili mo. Dadaling ka na sa operating room. First class lahat, I would say. First class, even the machines that they use.
The surgery is actually done by local anesthesia. I do it with just drops, topical drops. In fact, I only use one drop before I start, and then drape, put the sterile drapes on, and then the microscope will be focused on the eye, and then we make our incisions, our initial incisions, and then using the machine, we remove the cataract by phacoemulsification, and then after that, after the cataract is removed, we put an implant. So it's a lens implant that we put inside to replace the cataractus lens. It's a sutureless procedure essentially. All in all, together with preparation, will be done in about 45 minutes from the time the patient walks in to the time the patient walks out the door.
The safety and effectiveness of cataract surgery depends on the skill of the surgeon, the type of equipment, and the quality of materials used. There have been numerous cases where the use of cheap, substandard implants and surgical materials have resulted in complications and unwanted effects. In the best hospitals in the Philippines and all over the world, cataract surgery is carried out by well-trained eye surgeons using state-of-the-art equipment. They use only the best materials and the best intraocular lenses approved by the FDA and the BFAD. This guarantees the safety of the patient and ensures successful results.
Right after the operation, maliwanag na maliwanag, dinalang na ako doon sa labas, pinagbihis na ako. Sabi sa akin, kung ready na po kayo, pwede nang umalis kayo anytime. Ako na mismo nag-drive. Ako nag-drive. Right after the operation, ibang-iba yung paningin ko sa right side.
Not only is cataract surgery quick and usually pain-free, it is also an outpatient procedure. This means that there is no need for patients to be confined in the hospital overnight. They can immediately go home after the surgery, and more importantly, they can immediately see the difference in their vision the following day.
And then after the operation, I saw color differently. For example, this one, I thought this was black all the time. Then I found out it's blue pala ito. And then the pale in the bathroom, I thought it was green. After the operation, it turned out it was blue. So I go, iba-iba pala ang kulay. Ba't hindi ka ako nakikita ko noong araw? And after the operation, up to now, up to this day, I'm still surprised at the things that I thought were the real colors, when in fact they were not. And then vivid. Sabi ko, well, it makes you appreciate more the colors around you.
With the help of modern technology, cataracts can now be removed quickly and pain-free. It's an outpatient procedure, and recovery is almost immediate. However, it is still important that a cataract be detected as soon as possible. The earlier your eye doctor can diagnose your cataract, the easier it is for him or her to treat it. So if you or anyone you know has the following symptoms, it is best to see an eye doctor immediately. To make sure you get the best possible treatment for your cataract, choose a doctor who has the proper credentials. Don't forget to ask your doctor which medicines, which equipment, and which surgical materials and intraocular lenses they will be using for you. And go to a hospital that is equipped with the best facilities, preferably one that is accredited by the JCI or Joint Commission International.
JCI accreditation is an accreditation of a hospital based on standards that have been set internationally. The significance of this is that these are standards that look at safety of processes in the hospital so that you're sure as a patient that if you come to this hospital with a JCI accreditation, all the processes that occur within that hospital are there for continuous improvement in the quality of care and, more importantly, for enhanced patient safety.
Dapat siguro, pag nalaman nyo may katarata kayo, pag sinabi na talagang dapat i-opera na, don't delay. Baka mabulag, magka-trauma yung mata mo.
And the sooner the better. So that your vision is very important. Reading is very important. So if your eyesight is not on par, then you will not enjoy really seeing people and seeing things.
Every day, doctors are helping more and more people take advantage of the latest technological advances to remove cataracts. And every day, more and more people are seeing the world in a different light.